So for our Senior Dimensions members in the area, they have continued coverage through the end of the year. They don't need to do anything. If they have questions, they can turn over the card and call us, and we'll help them through with any specific questions. But in addition to the Senior Dimensions program, every year CMS, Centers for Medicare and Medicaid, holds an open enrollment period from October 15th through the end of the year for enrollment period 2012. So right now, seniors don't have to do anything at all if they're with Senior Dimensions. They can stay with their program and their physician, and during the open enrollment period, they can look and see what the benefits are for 2012.
Do you feel canceling coverage because of a business decision is an acceptable answer to patients losing their doctors?
Well, in the community here, we're talking about 10 physicians that have made a different business decision and have affiliated with another entity. And we have since expanded and contracted more than 10 new physicians in the community and are looking at how we pace benefits and costs for 2012. So our thinking was to give folks as much time as possible to make a decision if they needed to prior to open enrollment. And again, they don't have to do anything now, but if they'd like to, we're willing to assist them in doing that. So it really is a business decision made by some local physicians that's changed the dynamic to some degree.
All right. Is continuing of care important? If so, why not extend the date as a courtesy to seniors so that they may avoid the gap in coverage?
Absolutely, that's a great question. So continuity of care is established both with federal guidelines with this program and state guidelines. So again, if you call the number on the back of your card, and we'll walk through those with you. But if you're in cancer treatment, for example, or third trimester of pregnancy, or transplant situations, you don't need to worry about this. There will be provisions made. And again, the program, Senior Dimensions, is everything we do is approved and sanctioned by the Centers for Medicare and Medicaid, and they are very mindful of anybody that might be in a period where they need continued care and access to their physician due to a health situation, and those are protected under the regulations of this program. So it's a good question. If members have a question, they should call in and say, I'm seeing my doctor for the end of the year for cancer treatment, for example, and provisions will be made.